Melanie, how are you today?
Good, how are you?
I'm good. I'm Paige and I'm going to be your nurse today. First, I have this brochure for you that goes over everything that we're covering today that the dietitian talks to you about and the doctor, so you'll have everything to take home with you. First, I just want to educate you on kind of how to manage diabetes. There's ways to control it and so that you aren't having hyperglycemia or hypoglycemia. So it's important to maintain weight, a specific weight for you, just a healthy weight, and it's important to exercise daily. So even going for a walk if you need to, or if you like running, or just anything that has to do with exercise is good. It's important to control your carb intake, so make sure you're not eating too many carbs. I know the dietitian will go over that with you also. Monitor your blood sugar levels, so you're going to have to pick your finger, but it's just a quick poke and then you're done, and then you can see what your levels are. The normal levels are 70 to 100, so you're going to kind of know what your normal levels will be. Diabetes can cause different complications. They're called microvascular and macrovascular. So the macrovascular are like your cardiovascular diseases and stuff, which as long as you're managing it, you should be fine. But I just want to let you know that the microvascular, it can cause vision changes or nephropathy, so problems with your kidneys, and it can also cause neuropathy, so you might lose feeling in your feet. If that happens, you need to make sure you're going to the doctor, calling your doctor, because that can lead to problems. And make sure you're testing like your water when you get in with your hands, not your feet, if you lose feeling, because that can cause injuries. It's important to store your insulin in a fridge that's not being used. Make sure you're not freezing it or keeping it in the sunlight. But the insulin that you are currently using, it's okay to keep it in just room temperature. So make sure that is being under control. It's important to be safe with your insulin, so make sure you're wearing gloves and doing all the precautions to make sure you're not contaminating or anything. Check the expiration date on the insulin, make sure it's not outdated or anything, because that can be a huge problem. Make sure you're calling your doctor if it is outdated at all. Make sure you're getting your yearly eye exams, because like I said, it can cause vision problems, so make sure you're going to the eye doctor and all that good stuff. So if you have hypoglycemia, it's important to know that you need to carry sugary food, like foods with sugar in them, like such as like if you're home, you can do like a teaspoon of honey. That can help. So make sure you're checking your levels all the time, and sometimes you'll feel like kind of off, so make sure you're making sure you're keeping up on that, because that can be really bad if it gets too low. So yeah, and the dietitian will be here to meal plan with you and everything, so that will be under control. So do you have any questions for me? I know it's a lot of information, but all right, thank you.
Hi Melanie, how you doing today?
Good, how are you?
Good. So I'm Dr. Cooper. So I know we just diagnosed you with type 2 diabetes. She obviously gave you that brochure, so that was nice for her. I know this is gonna be a lot of information, but now I'm gonna go over some medications that we typically use, just some common ones. You're not ever gonna find like those crazy names that nobody ever knows and no one ever knows anything about them. So just some oral like pills that we use is called metformin or glucophage. So this lowers your blood sugar. It decreases the amount that your liver will produce, and it's also making your muscle tissue sensitive to the insulin. So the sugar can then be absorbed, okay? You'll usually take this, if you're on this, it'll be 2 times a day. And diarrhea is a side effect, but it's been known that if you eat with it and you don't take it on an empty stomach, things like that, it kind of decreases that side effect. Another one is glipizide or glucotrol. We usually just call it glucotrol. So this helps with like your beta cells that are in your pancreas release more of that insulin to help bring your sugar back to where it needs to be. So if you're on this one, you usually take it like once or twice a day, just depends on how bad it is, and before meals. So sometimes we use those two oral medications together because one's long acting and one is short acting. When I say long acting, I mean it takes longer for it to process in your body and it lasts longer in your body. When it's short acting, it's quick to get in your body and it's quick to get out of your body. So that's why we usually use them together. The long-acting ones, though, when we use them together, the long-acting, it stays in your body, so it's kind of like hiding in the background is what we like to call it. So it's kind of doing like undercover work in a sense, if you want to call it that. So some like injectable insulins that we use, that they might have you on, we might put you on like a pill, and then we might do a fast-acting insulin because it might be too high and we just need to quickly get it back down to normal ranges. So there's a rapid acting one. It gets right into your body within 15 minutes after being injected. So those ones are called like Humalog, and there's one called Novolog too. Those are just more simpler names. So it just all depends, like I said. And then there's a short acting one, just regular short acting. This usually will hit your bloodstream within 30 minutes after being injected. So this is your stuff like Humulin R, Novolin R. R is for regular or short. Then you have long-acting insulins as well. So this will reach your bloodstream. It's several hours after it's being injected. So this will take 24 hours to lower your blood sugar. So this one's if we're using this one, then we're using we might use a short-acting oral medication just to kind of keep it balanced and not too high or too low, you know. Some examples of those are called Levemir or Basaglar or Lantus. I know these words are very odd, sometimes they're weird, but we'll definitely direct you in the right direction and we'll help you with anything that you do need help with. I do know the nurse and the dietitian and the social worker will be in to discuss more things with you. But if you do have any questions, they can page me back in. I don't have any problem coming back to do more education if need be, okay? So do you have any questions right now for me?
No.
Okay, sounds good.
Hi Melanie, how are you today?
Good, how are you?
I'm good. I'm Barbara. I'm your nutritionist. Mind if I have a seat? So you've been diagnosed with type 2 diabetes. Okay. One of the biggest things with type 2 diabetes, sometimes you may need insulin. It's going to depend on your blood glucose level. It's going to depend on your A1C number and your blood lipid levels. Okay, so everybody's got a specific diet that's for them. There's not a diet that's just for everybody. So if you know anybody in the family or a neighbor or a friend that's diabetic, you're not necessarily going to be using the same diet that they're on, okay? So your doctor may advise you to maybe do more of one thing or less of another thing to try and keep those numbers in check, all right? The biggest thing, what do you normally typically eat? Do you take in a lot of sugar now?
Sometimes, yeah.
Okay, you're going to want to watch drinks.
Okay.
No sucralose or high fructose corn syrup in your drinks. They carry a lot of sugar. So try and stay away from anything with added sugars. Try and eat fresh fruits and vegetables. And you're going to want to have lean meats, legumes, dairy products, and whole wheat products. So white bread tends to elevate blood sugars, so try and avoid white breads and stick with, if you like your morning bagel or your English muffin or your sandwiches, try and choose things that are whole wheat, okay? Low sodium, low cholesterol, and you want to limit alcohol. I don't know if you're a drinker, but if you're a drinker, limit your alcohol because it can increase or decrease your sugar, okay? Trans fats, those are going to be some dairy products, they're going to be processed foods. Try and avoid those, okay? And saturated fats. So if you set it out and it turns to room temperature, you don't want it. So try and stick with regular butter because margarine will liquefy. So it's not a good fat for you. And there's gonna be times, and it may be possible that your sugar's gonna drop. So keep, they've got glucagon kits that you can carry with you, and it's just like, maybe just a little hard candy or something, and you can take chew a second on one of those, and it'll elevate your blood sugar and bring you back up, because you don't want hypoglycemia. You don't want your sugar to drop, and right now your sugar's high, so you're hyperglycemia. We gotta try and get you balanced out. A medical alert bracelet is great. If something should happen with your diabetes and you can't convey the information, a medical care team's gonna need to know that you're diabetic. And exercise, they're recommending 30 minutes a day of activity. It can be fast walking, it can be aerobics, it can be strengthening, whatever you feel that you're up to. Your doctor will go into you better depending on what your glucose level is prior to. You may do a lower dose of insulin if you're on insulin. If you're diet controlled, then just eat a small snack before you exercise. Check your glucose before, during, and after. You don't want those levels to drop. And but that also helps with your lowering your BMI, because weight is a big thing with diabetic. And if you lower your BMI and you keep everything on track with your sugars, it can help lower your risk for stroke, for heart disease, any kind of nerve damage. So diabetes kind of affects everything, so that will help kind of bring everything down and keep everything good. And do you have any questions for me?
No, you covered everything.
Okay, great. The nurse and the doctor will be with them shortly. If you have any questions you need me later, just ask for me and they'll bring me back.
Okay,
All right,
thank you.
thank you.
Hello, I'm Melanie. I'm the social worker.
Hi.
How are you today?
Good. How are you?
Good. I see that everyone came in to visit you.
Yes.
Do you have any questions so far?
No.
No?
It's a lot of information.
So I'm here to make sure that you are comfortable with everything, that you have all the information. Diabetes is going to be such a life changer for you, and I want to make sure that you are comfortable with everything, and that if you have any questions, that they're all answered. So with diabetes, it's going to change everything, you know, your money situation, your support system, and it does take a big toll on your life. Like, you have to exercise, your diet has to change, and you have to make sure you're keeping up with your treatment and everything. Does your culture affect your treatment regimen at all?
No.
Okay. Do you have a big support system at home?
Yeah.
Does your family understand anything about your treatment, and are they able to help you at any point in time?
Yes. Yeah.
Okay. So, because this is going to take a big toll, it is important that you do have this support system, and that you are keeping up with support systems. There are support groups, like Hurley has one, U of M Flint, or U of M Hospital, and if you don't want to go out and talk to anyone, there are support groups on Facebook so you can keep to yourself, but it is important for you to talk it out because you're not alone. Your care team is going to take care of you. If you have any questions, feel free to talk to them. Because again, diabetes is going to take a big toll, and it's going to cause depression, anxiety if you feel like you're alone, if you're not educated on it. So I want to make sure if you have any questions that you come talk to me, because I will support you in any way possible.
Okay.
Okay. Do you have any questions?
No.
Okay. Hi Melanie, I'm back again. So now that you got all that information from everybody, I just kind of came in to explain how to take your sugar, and because that's kind of the main thing that controls everything. It controls your treatment, the medications, everything that goes along with your diabetes. So first you're going to do hand hygiene. You're going to make sure you're washing your hands. You're going to get sent a kit that has the glucometer, the test strips, everything in it that you're going to need to check your sugar. So you're going to have a glucometer, a test strip, alcohol swabs, the needles, and what you're going to do is you're going to make sure that the steps will be on the screen, so that's kind of easy. The monitor will kind of walk you through it. Then you're going to stick the test strip in, and then it's going to tell you that it's ready to get your blood. So you're going to make sure you wipe your finger with an alcohol swab. You're going to poke yourself in the finger with a little tiny needle, and then you're going to put the blood right on the test strip, and then it's going to read what your sugar is, and hopefully we can get that number under control. It might be high a little bit at first until it gets under control, But so yeah, that's how you check your sugar. Does that make sense to you?
Yeah.
Okay, it's a pretty easy process, but if you have any questions at any time, or once you receive your kit, if you want to come back and we can show you how to use it exactly, you can do that also. So, do you have any other questions?
Do I use the same finger for each test, or do I use?
I would maybe start out by using different fingers just so one finger doesn't get too irritated, but as you go on, like you might have one that you just choose that you want to be poked. So yeah, but I would start out by switching fingers. Any more questions?
No.
All right, thank you.